And welcome back. You're listening to Smooth 98.1. I love music, love life. If you're just tuning in and you just tuned into the dial where you're just in time for Smooth Health on the Drive. My name is Judith TV.
I'm Kylie Baker.
And Smooth Health is brought to you by Evercare Hospital.
All right, so we've got a very special guest at the studio today, and we're talking about something that we think every single Nigerian should be aware of. We're talking about stroke, we're talking symptoms, we're talking preventive care and treatment options as well. And we've got a neurologist in the studio to discuss this with us, okay? We have Dr. Adefemi Daniel, and he's going to be having that conversation with us on the show today.
Yes, Dr. Adefemi Daniel Daniel is a consultant neurologist with an interest in movement disorders, and he joined the International Parkinson's and Movement Disorders Society. Dr. Daniel is currently a full-time consultant neurologist at Evercare Hospital, Lekki, where he works with a team of excellent professionals whose core mission is the delivery of quality healthcare services to Nigeria. His areas of interest are stroke, movement disorders, and neuro rehabilitation, and he is a member of the Nigerian Society for Neurological Sciences and the American Academy of Neurology. Ladies and gentlemen, please put your hands together and welcome Dr. Daniel. Doctor, you're welcome to the show.
Doctor and the crowd goes wild.
No. Doctor, you're welcome. How are you doing today?
Thank you very much, guys.
Doctor is quite tall.
Very tall.
He's pretty much like 6'5".
Are you 6'5"?
6'5".
Yeah, about that. 6'6". Actually.
Oh, no wonder it's like, I don't know what she saw, but like, maybe it's my haircut or something. But I mean, maybe she missed 1 inch.
My shoes are probably helping a bit.
No, I don't think so.
You're welcome to show Doctor. He's really tall, but you're welcome to show Doctor.
It's been my pleasure.
Yeah.
You can be a part of our conversation,
yes,
and also win the vouchers we've talked about at the start of the show. Okay, we're giving out vouchers courtesy Evercare Hospital. They are vouchers worth 10,000 naira for your free consult or your first consultation, basically. So please call the number 01448991 and send WhatsApp messages to 0809-444-0981.
Yes, indeed. So, Doctor, let's get started, shall we? So, I need to know. Tell me, you're a neurologist, but who is a neurologist, and what are your focus areas? And is it the brain, only the brain?
Yeah, thanks for the question. So it's nice to be here, and first, thanks for all of the effort you guys are making.
Thank you.
Increasing the awareness of Nigerians.
Thank you so much.
Their health and all. So a neurologist is a physician or specialist who basically deals with diseases of the nervous system. Brain, spinal cord, the peripheral nerves, right? And some muscle disorders. But as long as they have no surgical import, meaning that the diseases do not get amenable through surgery, then you're likely to need the neurologist. The neurologist is actually called the neurophysician.
Okay.
Oh.
So most of what you deal with are things like dementia, epilepsy, movement disorders, stroke, and some sleep disorders. There's so many other non-surgery related diseases that can affect the human body. That's what the neurologist deals with.
So you come in and then you take a look at the situation, and how do you
It's largely it's one of those specialties that has a lot of clinical evaluation that requires a lot of clinical
involvement.
Yes, it's not about the test really. Your tests have to help you confirm a diagnosis, but in neurology you have to have your clinical diagnosis has to be very, very accurate for most of the time, confirmed by tests.
Okay.
All right.
So according to the World Stroke Organization's Global Stroke Fact Sheet, which was released in 2019, they're saying that 13 million new stroke cases are reported annually. So what is stroke generally, and also what are its causes?
Yeah, thanks again for that. So that value you've given, like I said to someone yesterday, I actually think I am aware that in 2021 or 2020 the value was actually increased to about 17 million.
17 million.
Yes. So it's actually rising. Cases. That's right. The incidence is rising, and it's rising in the low and middle income economies rather than the Western world, where it initially was, of course, diagnosed more readily. We think there is an epidemiological transition. So many more cardiovascular illnesses are now being found amongst us, yes. At some point, some researchers actually considered infection, which has always been the bane of sub-Saharan Africa, as possible cause of stroke. In fact, to the point where, but in more recent times, cardiovascular illnesses, diabetes, hypertension, high cholesterol levels are becoming more frequently, more prevalent amongst our people here. So it's only natural for you to have the diseases of the cardiovascular system, which also can affect the cerebral vascular, that's the blood vessels of the brain. And therefore stroke is getting more common amongst us. You should know that in the teaching hospital, all teaching hospitals in Nigeria, stroke is the leading diagnosis for admission for neurological disorders in the emergency rooms, as it is the leading neurological condition. Even in a private hospital, in big private hospitals in Lagos, it accounts for at least a third of the outpatient consultation diagnosis. So whether it's inpatient or outpatient is actually an issue. And of course, an inpatient is the one that's admitted to the emergency room because its issues are very grave. The outpatient is coming for follow-up after a lot of, some admission from previous stroke. So when you ask for epidemiology, is rising. That's the truth.
And this has been a pattern for quite a while now.
Yes, in the last at least 10 years in Nigeria, the prevalence rising more towards us. At some point, the word epidemic would have been used to even describe it. But epidemic is usually used for certain specific disease conditions, geographical populations, but it hasn't that close. But what we mean is that there is a high burden of stroke, even in sub-Saharan Africa, with data to prove it. As you did ask, the second question you asked was the
causes.
The causes of stroke. Well, when we talk about stroke, we actually talk about risk factors. You see, the definition itself recognizes any progressive neurological signs or symptom that arise as a result of an interruption of blood supply to the brain. The thing that makes stroke different is that it has to be that there is a blood vessel disease, what you call cerebral vascular disease.
Blood vessel disease?
Yes, there is a disease of the blood vessels that puts them at risk of either getting blocked or tearing or rupturing or busting in the brain.
What kind of diseases are they?
So this is what atherosclerosis, which is when you have cholesterol depositing on the, fat plaques depositing on the walls of the blood vessels.
Okay.
This is what the outcome of long-standing hypertension, long-standing diabetes, long-standing high cholesterol levels, excessive cigarette smoking, a lot of alcohol ingestion. These things have a way of damaging blood vessels such that those vessels become either so capable of getting obstructed in the course of, therefore, disrupting blood flow, or rupturing, meaning tearing or breaking. The brain is like a sponge. If you have a break in the blood vessel that is carrying blood into the brain, a burst would therefore cause blood to, it's like a bleed into the brain. But if you have a plaque or some kind of obstructive lesion or, some blood clot that blocks the blood vessels, then you have what they call ischemic stroke, which are the two types of stroke anyway. One in which there's a blockage of blood supply, or one in which there's a tear in the blood vessel. So that's a hemorrhagic stroke or an ischemic stroke.
Let me ask this question like a layman, and like most Nigerians would think. So prior to this time, a lot of people, including myself, had the impression that high blood pressure, hypertension, those were the major causes or leading causes for stroke. But now, you've clearly opened our eyes to other things. You're talking about, cholesterol, amongst other things. Could you explain the role of hypertension and also high blood pressure, amongst other things, in the case of stroke?
Very nice. Thanks again. So let's put it in perspective. There are risk factors to blood vessel disease. One of them is aging.
Aging?
Yes. Through a natural process of degeneration, blood vessels become either friable or too weak to maintain the passage of blood through them.
Okay.
Without the potential for rupture. So age is a risk factor for stroke, but it is a non-modifiable, meaning you can't stop growing older. The gender, stroke is more likely to be found in male population. All right?
In male population?
In the male population.
Okay.
You can't change your gender. You can change your gender, but
you can't just change your gender.
Your genetic gender is still the same.
Yes.
Okay? If you've had a family history of stroke, for instance, I can't stop you from that. Is a recognized history. You have had a family history of stroke, but it is a risk factor for a stroke in you. All right? Or if you've had a stroke before, then you can have. Now, those are non-modifiable risk factors, meaning we can't do anything about them. But when you think about hypertension, I can control blood pressure.
Yes.
I can control blood sugar. I can reduce cholesterol. I can stop smoking. All right? I can stop living this sedentary lifestyle. If I have a heart disease, I can take my drugs to make sure that blood clots do not form in my heart through the use of blood thinners. I can be consistent with the drugs. So whenever you have a modifiable risk factor, that is the responsibility of the individual to prevent stroke. All right.
Okay. Well, that's that's an even bigger eye-opener still.
Yeah. Join the conversation, please. We would like for you to, and if you do, you stand a chance to win a voucher worth 10,000 naira courtesy Evercare Hospital, and that goes to your very first consultancy fee at Evercare Hospital. We're talking stroke, symptoms, preventive care, and treatment options. You can send your messages to 0809-444-0981. Again, 0809-444-0981. So, Doctor, you've talked about the risk factors, and just what causes it, but talk to me about the symptoms. What are the symptoms of stroke?
Thanks. So, like I said earlier, rapidly evolving signs and symptoms for which are the result of an obstruction or interruption of blood supply to the brain. All right? It depends on which side of the brain has been affected. But the typical ones we know are the sudden weakness of one side of the body, arm and leg.
Yes.
Plus the face too. All right? So my face suddenly. But the good side of it is this. When taking the history in a patient who's got stroke, you must get the word sudden. The suddenness of it, meaning you can put a date and time to when that event. I was eating, and when I just realized I couldn't
move your arm.
It's not that I think it was a few days ago when no, all those things. There are other things that can cause the same kind of symptoms, but it is stroke because it is sudden and onset, and I can put a date and time to it.
Okay.
All right. So sudden onset visual field defects, because there are arteries that supply the eyes. Sudden onset, suddenly I can't see one side of my face. All right? Suddenly I lose balance and I cannot maintain a steady gait. Suddenly I feel completely unable to, my sensation on one side is completely lost. And of course, the one you know is suddenly I can maybe have slurred speech. I can't speak up.
Yes.
Or my face is twisted to one side. Suddenly I'm able to lift up my arm or my leg on one side. Those are the very common ones. But suddenly death too. Because sometimes while you think about stroke as being a focal problem, meaning affecting a small blood vessel in the brain, it can actually happen that the whole of the brain has been involved in a reduction in blood supply, usually due to a heart problem, where some drop in the amount of blood reaching the brain the amount of blood reaching the brain has been compromised significantly. So death can occur due to what we call
sudden death.
Yes, sudden global cerebral hypoperfusion, meaning global, the whole brain, cerebral, brain, dropped in blood supply. That is a form of stroke.
But what could cause? Well, you mentioned it's a form of, but I'm just curious now because I've heard of cases of sudden death, and sometimes you wonder what happened. Maybe it's an illness that wasn't spotted. But what could cause, how do I put this now? You said a drop in blood, but what could cause that?
Okay, usually there are things, you see, there are, I did forget to tell you about sudden difficulty swallowing, and we did mention difficulty speaking, right?
Yes.
Now, the most common experience I've had as to cause of that has to do with what they call an anesthetic complication. Someone maybe is supposed to have a surgical procedure, and you have an issue where the heart has been tampered with in terms of its function.
Okay.
In the course of some other medical experience, and the heart perhaps stops.
Couldn't pump in blood.
That's right. Severe cardiac arrest, or those kind of things happen, and you hope that you can revive the patient. The heart stops again, but by the time you're perfusing the brain again with a normal heart, the damage has already been done, and you have a patient who's got, the neurological signs and symptoms of a stroke.
Wow. If you just joined us, well, this has been quite the insight. Still is the insight. So call us and let's have this conversation. Dr. Adefemi Daniel, who is a consultant neurologist with Evercare Hospital, is discussing with us stroke symptoms, preventive care, and treatment options. We'll go on a quick break. When we get back, we'll do some more talking. Stay with us.
Smooth health on the drive.
So Lagos, if you didn't know, now you know.
Stay tuned.
Driving Lagos.
Simple rules for driving safely around Lagos. Did you know that the highway code has rules about warning signals? When you see the danger sign, slow down till further notice to a crawl if need be. Do not exceed 50 kilometers per hour. Simple rules for driving safely around Lagos.
This is Lagos.
You've been served. You've been served.
The best.
Music from around the world.
Put us into a groove.
Right here on Smooth.
The music play. You won't get Smooth 98.1.
Hi, my name is Kate Henshaw, and you're listening to Smooth 98.1 for intelligent talk and music that puts you in the mood.
Music is about soul healing vibes that transcend you with lyrical grooves, lifting you into love as you flow through life. My music is frequency 98.1. Love music, love life. You're listening to Mind Muse.
Hello, I'm Richard Quest of CNN. This is Smooth 98.1. 98.1.
Smooth health on the drive.
So Lagos, if you didn't know, now you know.
Stay tuned.
Welcome back. You're listening to Smooth 98.1. Love music, love life. We are here, the second half of the Smooth Health on the Drive, brought to you by Evercare Hospital. My name is Judith Atibi. Kaide is here with his thumbs up over there. You can catch us live, by the way. We're streaming on YouTube, so go to YouTube. It's www.youtube.com/smooth981fm. We're talking about stroke, symptoms and preventive care, as well as treatment options when it comes to stroke in Nigeria. Join the conversation on our telephone line on 014489981. Again, 014489981. You can also send us a WhatsApp message and stand a chance to win a voucher worth 10,000 naira, courtesy Evercare Hospital, on our WhatsApp platform there. So send those questions for the doctor today on 0809-444-0981. Again, 0809-444-0981. We saw our phone buzzing. I think you calling us back. Let's see who that is.
Hello, good evening.
Hello, good evening.
Good evening, sir.
Good evening, sir. How are you doing today?
I'm okay, thank you.
All right, your name, sir?
Yeah, my name is John. I'm calling from Akata.
John is calling from Akata.
Yes.
All right, go ahead, John.
Doctor, I want to find out how can you, your advice on how to manage primary hypertension. You know, somebody have been elevated.
Primary what, sir?
Primary hypertension.
Primary hypertension.
Yes, sir. Somebody have elevated blood pressure. You've done all the home medical tests. You did ECG, you did echo, you did blood cholesterol, and nothing. Everything seems normal, but the blood pressure keep on getting up and down. You know, so I just need to say your advice on how such can be handled. You know. Thank you.
Thank you so much, John. Appreciate your call there. Keep your calls coming on 0809-444-0981. Again, 0809-444-0981. You can also send in your WhatsApp messages to 0809-444-0981.
Okay, so I think this was Alex that just called, or rather John that just called in. He says, how can you manage primary hypertension that is not traced to any other medical condition? And here's another one by Bashir. Bashir says, I normally experience serious cramps in my left hand and
I think he means leg and hand.
Leg and hand at night when I sleep. What sign is this?
And then this is Bolao, and he goes, "Hey guys, can the doctor speak difference between TIA and actual stroke? What are immediate actions to be taken before help arrives?" And that's from Bolao there.
Yeah, thanks, Juliet and Kylie. We thank you for the questions. I think I'll take the last one first because it's actually more directed at the topic we're discussing. Just like I said, an interruption of blood supply to the brain is what you call ischemia. All right? Ischemia means that you have, when there's an obstruction, just like a pipe carrying fluid through, everything beyond that obstruction is at risk of denial of the fluid that is supposed, in this case is blood. Okay. Now when we say someone has a transient ischemic attack, what we said is that what we are trying to say is that just briefly there was an obstruction, but was not enough to cause any damage that he didn't recover from. So whatever signs he had from that obstruction resolved immediately. Technically, it's supposed to have resolved within 24 hours. But because we have found out that sometimes, if you have to wait for 24 hours to make a diagnosis of transient ischemic attack against stroke, you may miss those who actually have real strokes who have come even less than 24 hours. That's less than 24 hours after symptoms arose. What am I trying to say? If you came to me and said, "Oh, I suddenly had weakness of one side of my body and slurred speech and facial deviation about 2 p.m.
Yeah.
And by the next morning, or by 3 p.m., or let's say before the end of the day, the thing resolved." Okay, it's easy for us to assume this was a TIA. This was a transient ischemic attack. But by the time I do a brain CT scan, I found out that, they actually had a blockage. Then it would be wrong for us to be making retrospective diagnosis of stroke, of a stroke, because a stroke means that you have evidence of tissue damage. All right? Now, if we have a situation where so let's both put it this way. The technical term says that if your symptoms last beyond 24 hours, assume or confirm this is a clinical diagnosis of stroke can be made.
Okay.
But we know that sometimes symptoms can resolve before 24 hours, but a stroke has occurred. And that is why now there's a proposal to redefine stroke on the World Health Organization standard and say, look, if symptoms last less than an hour and we do not find any evidence on our brain scans for a damage to the brain, make a diagnosis of transient ischemic attack. But whatever it is, if you do a scan and you see whether it's less than an hour or it's greater than an hour, and you see any evidence of tissue damage, that is a stroke. Therefore, TIA is actually a retrospective diagnosis. I hope you understand, to save more lives. It is important that people recognize this difference because of one thing. In Evercare, we are able to offer you drugs that break down these blood clots that can cause stroke. And those blood clots you have to start those drugs within the first 3 to 4.5 hours of symptoms.
But how then? So what you between the first 3 to 4 hours of symptoms? What if the person doesn't come in until maybe a week after?
So that's where the concept of awareness.
I'm just saying. I'm saying. No, so what if the person doesn't come in a day, 2 days, a week after?
But the truth is that with media and with a lot of enlightenment, these things are no longer people are no longer as ignorant as we were back then. All right, people have symptoms and do not know what to do with them because of lack of enlightenment.
Yes.
So that's why there's a campaign for what they call Be Fast. Once you have balance issues for B, or you have eye signs where your visual field is suddenly having a problem, or you have a facial asymmetry, or an arm weakness, or a speech defect, then you have to be you know that you are racing against time. That's what they call the Be Fast. It used to be called Fast, but it's now called Be Fast because they want to recognize the concept of balance and vision as being part of stroke symptoms. And the time there, that's the T, is trying to tell you that you must get to a facility that is capable of offering you a drug that can break these these clots down so that your symptoms can resolve with minimum rehabilitation care. But if you come a week after this thing has happened, we still have something to do for you, but you do not benefit from the possibility of the use of these drugs, which are called clot busters, which are available in our hospital and many other, and even in teaching hospitals in Lagos.
Well, I have this message here. This is Angel. It goes, hello, Smooth and Doctor. Sometimes my middle and foretoes on my left leg start bending involuntarily and can be quite painful. Is this a sign of stroke? My hands also quiver involuntarily sometimes. I do not smoke or drink, though my lifestyle is mostly sedentary. And we're going to tie that question as well to John's message asking how can you manage primary hypertension that is not traced to any other medical condition?
Well, okay, so we would discuss hypertension because it cuts across cardiovascular, neurological, and even renal or nephrological issues. Hypertension is a situation where there is a sustained elevated blood pressure.
Okay.
There are certain values, and you must have these values sustained more than 48 hours apart. Clinically, it must be more than 2 clinic visits more than 48 hours apart. And those values have to be taken with certain conditions met. The patient must not be talking, he mustn't have smoked a couple of days before, and things like that. When you say primary, it means that by genetic or by constitutional means, this guy's blood pressure is sustained above the average. Secondary would mean that something is wrong with the body and hypertension has arisen as a consequence of that thing. Typically, it is a kidney condition.
Okay.
All right, but there are hormonal conditions that can cause. When you ask how to control primary hypertension, it is about being consistent with the non-drug approaches which we have discussed here in terms of sedentary lifestyle, exercises, healthy diet, what else now? Reduce, just making sure that you keep a healthy lifestyle. Your food doesn't have enough calories, targeted approach.
Balance.
Yeah, avoid smoking, avoid alcohol, drink enough water, sleep adequately and all that. Then when you're dealing with blood pressure that doesn't seem to respond to that, because in actual fact, many times you want to try non-drug approaches first before you go to use drugs. But there are certain values that when you have a blood pressure value, doctor says, look, I think it's at this time, I'm not sure we can wait for you to be using lifestyle measures. You need to be on these drugs. But if you combine lifestyle measures with drugs, many times you may find that the blood pressure responds to the drugs and you may actually reduce the quantity you're taking. I think the most important thing everybody should go home with will be about non-drug approaches or lifestyle modifications, such that drugs are like an adjunct to it. I hope you understand. And then he's following up with his cardiologist or nephrologist or neurologist, as the case may be. But typically in hospital setting, the cardiologists deal with high blood pressure.
All right. Well, you make it sound as though all three of them should be on his speed dial. So, doctor, I'm feeling this way now. Let's quickly.
Doctor, we're almost out of time. Pretty much done here on the show. But I need to ask you, how can stroke be prevented, and what preventive medications are available? I know you talked about the one earlier that you take to break down the blood clots.
Yeah, that's right. Thanks again. So whenever we're discussing stroke, we talk about prevention at 3 levels.
Okay.
So the primary prevention level talks about controlling risk factors. Let me tell you something. There is a condition called sickle cell anemia.
Yes.
And it is a risk for stroke, a type of stroke, or different types of stroke. But you see, if you can prevent children from being born with sickle cell, that will be called primordial prevention, meaning you don't want the person to have even the risk factor. But when the person has established the risk factor in him, he's diabetic, he's hypertensive, he's high cholesterol, you're now trying to prevent these risk factors from getting complicated by a stroke. That is primary prevention. The stroke has happened. You've brought him to the hospital. His arm and leg are both weak, but you don't want them to get weaker. If anything, you want him to get better. All the drug treatments and things we give in the hospital to prevent it from worsening are called the secondary prevention.
Okay.
Now, he has improved. The blood pressure is better. His blood sugar is better, and we want him to go home. But we want him to get back to what he was doing as much as possible. That's what you call rehabilitation. And that is what we call tertiary prevention of the complications that can arise from this same stroke. And in Evercare, for instance, I would like to emphasize more on 2 things. The concept of being fast to get to the hospital before, as soon as the symptoms arise. And then the concept of rehabilitation, which is actually the bread and butter of real neurology. Because only through rehabilitation, through collective team approach, through improvement in physical function, through arm and leg, through speech, improvement in speech function, through improvement in dietary controls, through a collaboration of teams of members of different therapists, would you be able to help an individual who has suffered the consequences of any such disease back to the system or to society to become as useful as it was before this event occurred? And our hospital has a very strong rehab team. There's a lot of teamwork and team approach to healthcare in Evercare, which we want to sustain and allow for none of these, differences amongst kids that make you say to yourself, we can't talk to these people. But no, none of that. You need your physiotherapist.
It's all broken down.
It's all broken. You need to have a speech therapist to help you focus on this guy's speech and get him to be able to be audible again. All right? You need your physical therapist to help him start getting balanced in his gait and all that. As a neurologist, I have enough things to read about in terms of drug use. Why would I want to now
focus on speech therapy again? So you have a team of people that you work with.
That's right. We have clinical psychologists, speech therapists, we have physicians, therapists. And all of these are, strong nursing care, just to make sure that everything is in totality taken, that the patient may get the best when he's leaving the hospital.
All right. Thank you so much, Doctor. We wish we could extend this conversation, but for the sake of those out there that are looking to reach out to you at Evercare, how can the good people out there find you, and how can they,
The hospital is, look, when you get to phase 1, you can't even miss the hospital because it's there boldly staring at you.
Okay.
Evercare, located 1 Admiralty Way, all right? Admiralty Way on Lekki phase 1. That's Lekki Peninsula Scheme 1. It's on the right side when you're coming from that main gate. If you're coming from the Koyi Link Bridge gate, it's on your left side.
Oh, yeah.
Right.
And also, how can they find you as far as phone numbers and websites?
081-398-50710. That's our call center. 24-hour service. All you need to do is to specify what you want. And it will be, that's 081-398-50710.
And also the website?
The website is info@evercare.ng.
That's the email
address.
Oh, sorry, website www.evercare.ng.
All right, Doctor, thank you so much. Remember, the location is 1 Admiralty Way. That's by Admiralty Way / Bisola Durosimi Eti Drive, Lekki Phase 1. Just as you get into Lekki, you find it the biggest building you see. That's Evercare Hospital.
You guys are so modest.
It's so modest. Of course, it is huge. And also the website is www.evercare.ng. Again, evercare.ng. Call them up on 0813-985-0710. Again, 0813-985-0710. The email address is info@evercare.ng. Again, info@evercare.ng. Doctor, thank
you so much, Doctor.
It's been my pleasure, guys.
Thank you for
so
coming
much.
through.
Thank you, Nigerians.
If you did send in your messages, stay with us. We're going to be reaching out to you as quickly as possible, so you can send us your full details for the vouchers that you have won for your first consultancy or consultation, as the case may be now, at Evercare Hospital.
Yes, indeed. Stick around. More music on the other side. This is a Smooth Drive.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness of
health information and tips for optimal well-being.
How to prevent it, detect or treat it.
Every Thursday at 5:15 p.m.
So Lagos, if you didn't know, now you know.